Hi, my name's Patricia Lawson, and I'm a Tai Chi exercise instructor for Cleveland Clinic, Martin Health, and I'm here to share with you some of what I've learned. I started out in hardstyle martial arts almost 5 decades ago, doing very rigorous physical activity that took its toll in terms of arthritis and other health conditions. And I discovered the wonders of Tai Chi about 30 years ago. I've been in love with it ever since. It's something that's so good for everybody of every age. I've been teaching here for Cleveland Clinic for 15 years, sharing out different health exercise programs.
Hi, my name is Nancy Howard. I'm also an instructor for Martin and Cleveland Clinic. I started my career in the health industry. I've worked in doctor's offices, hospitals, and labs. I've also taught medical assisting, so I'm very aware of the body and the health aspects of the body. I went into a volunteer program for the Florida Department of Health. It was to prevent falls and teach balance to the elderly population. They found that teaching them Tai Chi prevented falls. So during that time, I found a purpose and a passion for Tai Chi. I had been a yoga instructor, and I found that the mind, body, spirit influence of yoga adapted perfectly to Tai Chi. So now I am mostly teaching Tai Chi and loving it and enjoy sharing it with others.
But what is Tai Chi? What does that mean? There's a lot of confusion over the term. And sometimes you'll hear Tai Chi Chuan, sometimes you'll hear Tai Chi, Tai Chi Chuan. It's all the same thing. It was an ancient exercise that started in China first as a martial art. So every movement does have a self-defense application. But over time, the soldiers needed help with their health. They weren't always the victors, and they needed to keep their fighting skills sharp while they supported their health through times of limited food or cold weather, etc. So the legend is that one of the monks developed Tai Chi exercise, incorporating what he learned in India about energy centers and how the body can support its own health if we take care of it right, if we use everything that we have at our disposal on energy lines. So Tai Chi is a slow motion, formerly martial art, today practice for health. Chronic disease, inflammatory disease, stress-related conditions are the major threat to our health today, and Tai Chi has evolved to help us combat those threats to health. So how does it support health, Nancy?
Well, it improves circulation, we know that. It also strengthens muscles, even though it doesn't look like we're moving that aerobically. It is proven to strengthen our muscles. Balance is very, very important, and it definitely has been proven to improve our balance and prevent falls. It's also good for anyone coming off of any kind of emotional stress, especially during these times with COVID and post-traumatic stress disorder. It reduces stress. It teaches us breathing and ways to adapt our breath to reduce stress. So it's actually a very good program to begin now that people are starting to come off of COVID and get back to life.
It incorporates a lot of breath, as Nancy said. So she's going to lead us through some breathing exercise in Tai Chi.
So the dantian is located 3 fingers below your belly button, 3 fingers within. If you were to put both palms over that location, that is your storage house for energy. It connects your upper body and your lower body. And by breathing, you're generating that energy throughout your body. Also with the deep breathing, you're sending fresh oxygen into every cell in your body. And when you bring the oxygen in, you're restoring every cell, you're revitalizing every cell in your body. And when you breathe out, you're letting go of any toxins. It also is a breath that when you breathe in, you're breathing in relaxation and wellness. And when you breathe out, you're letting go stress and anxiety. You can use visualization with your breath. You can visualize a beautiful white light coming in, cleansing your body. And when you breathe out, you can see a dark, cloudy light just leaving toxins and taking them out of your body and any anxiety or worry that you might have. So when you breathe, the concept is you expand your belly on the breath in. So if you were to put your hand on your lower belly and one above it, when you breathe in, you should feel your belly expand. And when you breathe out, you should feel your belly contract. So normally you breathe in to a count of 3 or 4. And when you breathe out, you make the breath a second or 2 longer. So everyone has different lung capacity. You can practice it at your own rate. And just think of breathing in deeply and exhaling fully. You can do that anytime. You can do it when you're stuck in traffic and you're stressed. You can do it while you're sitting in front of the TV. Just breathing is so beneficial, and no one can see you. So you can be just standing in the grocery line and breathing. So the breath is everything. So after breathing, after we practice breath, we normally begin our warm-ups. With the warm-ups, anyone can follow along. It doesn't take any special instruction. You can just follow us. We begin with our neck and we work down to our ankles. It covers all 3 main muscle groups. So I'm going to begin with my neck, and then Pat will follow, and we'll each rotate with different warm-ups. So you can join us if you would like. Bring your hands up, and tuck in your chin. Look at your hands and look down. And one more set. Breath in and breath out. Last time, both hands come to center. One hand passes. Look at the hand passing your shoulder. The other one passes your hips. Bring them together. Try not to go your full extension. Let your neck warm up. On this set, go about 60% of your range. And on this set, your full range. Remember, nothing should hurt. Just a nice, gentle, relaxing stretch. We'll continue with the neck.
So then we move on to shoulders, resting your hands at your side. Let's make small circles forward. Make sure nothing hurts. If it hurts, don't do it. Just imagine that you're doing it. Power of the mind. And then 3 back. Second warm-up for the shoulders, larger circles, gathering in, exhale.
Next warm-up is for your spine. You can pretend you're holding a large beach ball in front of you. You're keeping it away from you, keeping the sand off your body. Your shoulders are relaxed, your palms are facing each other. The energy travels between your palms. One hand passes the other. One reaches for heaven and the other for earth. You don't have to push hard. Just visualize your spine getting longer. It doesn't matter if you can do the exercise full extent. If you visualize it in your mind's eye, you're getting the same benefit in last time. Bring that ball back to center. You're going to hold it. Again, your shoulders are relaxed. You're just going to swivel it slightly to your head. Roll it over slowly. Bring it to the other side and roll it over. And one last set on both sides.
And we'll warm up the hips. Let's bring both hands over to the side. Sink all your weight into that leg and extend the opposite foot. Let it drop down. Center. Imagine you're pushing water across in front. Sink into your leg and extend the opposite leg. We're just warming up the hip joint. We're letting those tendons and ligaments extend a little bit in the joint, very gently. Nothing should hurt. Let's do one more pair. Second one for the hips. Let your hands hang back and put your left heel forward. I'm going to do mirror image. And even if you're seated, you could try this. I call it heel in the water, toe in the sand. So you're checking the water, come to middle, and then put the ball of your foot back, hands forward. Number 2 and 3. Other foot. Still warming up the hip. And if you feel a little bit unsteady, just hold on to something at your side. Put your hand on the wall or the back of a chair. Is this 3? Right? 3. And relax.
Or our knees. 2 open fists by your hips. Weight on your standing leg. Heel, toe. When the weight reaches the ball of your foot, you're going to punch out with your opposite hand. If you were to look down, you should be able to see your toe past your knee and bring it back. Heel, toe, ball of foot, and come back. Make sure you keep your spine straight and your back heel should stay down. Do not lift your back heel. And last time. Fists are still by your hips. Weight on your standing leg. You're going to lift your other leg. You can bring it down. You can tap down in front. Step out. If you prefer, you can try balancing out on your standing foot. And again, if you need a chair to hold on to, you can do that. And one more set.
And we'll warm up our ankles, crossing your hands in front just to let them rest a little bit. Let's do some forward flexion. Extending your foot, tap heel, ball, heel, ball, heel, ball. Now the other foot. Heel, ball, heel, ball, heel, ball. Sideways flexion. Try not to use your hip or your knee in this. We're just trying to flex the foot sideways. So try to tap the little toe down and then the big toe. One of my friends says corn, bunion, corn, bunion, corn, bunion. Then the other foot, the little toe, then the big toe. Sideways flexion. So we call them warm-ups 1, 2, 3. There are 2 exercises repeated 3 times for each of the 6 major muscle groups, all developed by the Tai Chi for Health Institute. Tai Chi is a moving exercise. We call the parts of it postures, but we never hold still. The whole idea is to keep moving so that the life force, the life energy, gets moved all throughout the body to increase vitality. Some of the postures are shorter, some are longer, and Nancy's going to share with us one of them.
So open and close. Your hands are, or your palms are facing each other. You have acupuncture location and energy channels between your palms. The chi travels between your palms. There's a magnetic force that is there. So it's not a simple this. When you're doing it, you're actually feeling the energy and the magnetic force between your hands. So your fingers are pointing up. Your hands are the distance of about the size of your head. When you bring them apart, your clavicles in the back come together, chest opens, and you bring them together. So you breathe in, and you breathe out. Breath in, and breath out.
This is a great exercise for increasing oxygenation in the lungs, which is really important during any flu season, and especially now during this pandemic. It's important that we use all of our lung space, and this is a great exercise for that. So in general, Tai Chi for Health forms will take postures such as open and closed hands and link them to other postures that are actually movements to create shorter, simpler sets of movements that can be used to directly address symptoms and discomforts from certain conditions. The programs that we teach are all designed by a medical team working with Tai Chi experts so that they're safe and effective. There are many, many medical studies out showing how effective different Tai Chi exercises can be for things like Parkinson's symptoms, stroke recovery, arthritis, diabetes is another big one, and just for general sense of well-being. We have a program called Tai Chi for Wellness, also known as Tai Chi for Rehabilitation, and it is great for anyone coming out of any kind of setback. That can include emotional, loss of a loved one. It can include a surgery, a joint replacement. It can include a mental issue or recovery from addiction. It can be practiced standing, seated, or even supine, lying flat in your bed. So it's a wonderful program, a nice little set, and we'd like to share it with you by showing you it now. We haven't taught you all of the movements, so it might be uncomfortable to do it with us, but you can certainly do the open and closed hands part with us because that move is in this set. The Tai Chi for Wellness program, also known as Tai Chi for Rehabilitation, is made up of some really simple movements that are designed to break the emotional downward spiral that happens whenever we face a setback. It can be physical, mental, or emotional. It could be joint replacement, a surgery. a cancer operation, chemotherapy. It could be a loss of a loved one, an emotional loss, some sort of grief. It can even be recovery from addiction or some sort of mental breakdown. This is a great program to help everybody get an attitude of positivity toward wanting to be well. It works with the endocrine system with some Chinese medicine principles, yet the movements are very simple. And it can be done seated. I'm showing you how someone who is in a wheelchair or might not have the stamina to stand for the whole set would do it. Nancy's going to be doing it standing, and it can even be done supine, lying flat in a bed. So with that, Tai Chi for wellness. Begin. Open and close hands with us. Thinking of mind, body, and spirit. Waving hands in clouds. Open and close hands, harmonizing the opposites, putting down your troubles and worries for now, sweep them away for another day. You can take them out in the sunshine and deal with them then. Open and close hands. And we'll do the other side, letting go of those things that bog us down. Sweep them over until you feel like facing them. Open and close. Wave hands in clouds. Open and close hands 3 times. Strong in your mind, strong in your body, and strong in spirit. And relax. We'd also like to show you a set that's just a little bit longer and has been shown in over 30 medically respected studies to reduce the incidence of falls, and it has been cited by the Center for Disease Control in America as the most effective exercise for fall prevention, except one-on-one appointments with a PT. That's the only thing that is more effective at improving balance. So we'd like to show you this. It has a bit more movements, so again, you can do the open close with us, but you don't have to learn the whole thing in one session.
Beginner's Sin Style.
thank you for spending this time with us to explore what Tai Chi exercise has to offer. So many benefits for people of all ages and abilities. We'd like you to remember that it is evidence-based now. Everything that we teach through Cleveland Clinic and Martin Health is safe and effective, modified according to people's conditions. Nothing should ever hurt, pinch, or pull in Tai Chi. And it is recognized by the CDC now as the most effective exercise for fall prevention. So check with your local regional Cleveland Clinic facility and see what's being offered for Tai Chi exercise that might help you. Thank you.